right. Welcome back to our study of the heart and the diseases of the heart. So we are going to finish the diseases and the notes right quick, finishing out with cardiac arrhythmias. So an arrhythmia is an abnormal heart rate. After this video, there'll be another video that's a review video for the test. So I highly encourage you guys to watch it as well to help prepare for the test. The review video will help you kind of zero in on what you need to study, because we've talked about a lot of things regarding the diseases and disorders of the heart. Okay, so today we're going to look at cardiac arrhythmias, and the normal contractility condition is called sinus rhythm, okay? This, if it's in a sinus rhythm, then that is considered normal. In your anatomy class, either in high school or in college, excuse me, or even actually if you take the second year courses at Allen Thornton, they go into a lot more detail about the electrical activity that happens in the heart, and what causes the heart to beat happens in the right atrium, which is, if you remember, that's the chamber that all the deoxygenated blood comes back to through the superior and inferior vena cava. And so it's called the SA node. That's part of the electrical system of the heart. But all you need to know for our purposes is that a normal heart rhythm is called a sinus rhythm. An abnormal contractility condition is an arrhythmia. So a not abnormal, any type of abnormal rhythm is going to be an arrhythmia, and we're going to look at several of those abnormal rhythms. This is where the ventricle or the atria is not contracting normally. So something is happening that these are not contracting normally. Okay, so in a minute, you are going to get out your EKG paper and trace the strips that are in here, but you don't have to trace this one. Okay. So the biggest thing that you need to know is that an electrocardiogram, it can be called an ECG or an EKG. ECG would be more accurate, electrocardiogram, but it's also called an EKG. What you are looking for when you're looking at EKGs is, does it have a P wave, okay? So this is just like the alphabet, all right? Does it have a P wave? Does each rhythm have a QRS complex, and does it have a T wave? Does every QRS complex have a P wave and a T wave? Okay, so these are things that you're looking for. So P comes before the big QRS complex, and the T is at the end. Okay. An EKG or an ECG does test the electrical activity of the heart. That is what it is testing for. Okay, so this is normal sinus rhythm. This is a normal strip, okay? So the first thing you want to do when you look at a strip is you want to determine the rate, okay? And the way that you determine the rate is by counting the QRS complexes. So that's the first thing that you want to do. A normal heart rate is 60 to 100, okay? Write that down out to the side on your notes, that a normal heart rate in an adult, we're only talking about adults, is 60 to 100. So when you were looking at a strip like this, there are always going to be 10-second strips, okay? So 1, 2, 3, 4, 5, 6, 7, 8 QRS complexes. 8 times 10 is 80. So you have a normal rate, okay? So that's how we know the rate is normal. Now, is the rhythm normal? So now we're going to look at what I just showed you in the other picture, okay? Does it have a P wave? Is the P wave before the QRS? Does it have a T wave, okay? So, is there a P wave in front of every QRS complex? Yes, there is. Is there a QRS complex? Yes, and there's a T wave. So this is what is considered normal sinus rhythm. Bradycardia, this is if the heart rate is less than 60, all right? So go ahead and write that out to the side. Bradycardia is a heart rate of less than 60. So this is a slow heartbeat, less than 60. And again, so the first thing we want to do is count the rate. And anytime you see a strip on any test, I don't care if it's a test from me, if it's a test later on in your life, you can assume something about every strip is that it's a 10-second strip. Okay, so the way you determine the rate is count the QRS complexes and multiply it by 10. So 1, 2, 3, 4, 5. Sort of looks like 5.5. Okay, but we have 5 full QRS complexes. So we have a rate of 50. So that is what makes it. We know it's slow. Okay. But is there anything else wrong? Is there a P wave for every QRS complex? Yes, there is. Is there a T wave? Yes. So this is sinus bradycardia. Sinus tachycardia is a fast heartbeat. So tachycardia is greater than 100. Okay, so write that out. Tachycardia is going to be greater than 100 in an adult. So let's count our QRS complexes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. 18 times 10 is 180. So this heart rate is 180. Hopefully this is somebody that is running or something like that. Okay, so the P and the T wave right here can kind of get jumbled up, but does every QRS complex have a distinguishable P wave before it? Yes, it actually does. And there's a distinguishable T, okay? In a minute, maybe the next strip, but in a minute there's going to be a strip where there's not a distinguishable P and there's not a distinguishable T, and you'll be able to see the difference. But in a minute, you're going to trace these onto your EKG paper to help you study, and so you'll definitely be able to see the difference then. Okay, so atrial fibrillation, before I show you this strip, let me tell you what's happening in the heart, okay? If it is fibrillating, and remember from our study of CPR, we talked about using a defibrillator, okay? So that when the heart is fibrillating, it is quivering, okay? It is not pumping, all right? The heart and its chambers, they need to actually pump and move that blood. If they're just quivering, then they aren't pumping blood all the way through. And atrial fibrillation is not necessarily lethal, okay? A ventricular fibrillation can be lethal, all right? But the atrium is just quivering. So these are the chambers at the top of the heart that are just quivering, all right? And they are contracting at faster than 350 beats per minute. It's almost, now you're not going to hear all of those, okay, because really, or see all of those, because what you're going to hear for the most part, and when I get back on Monday, we will listen again to Nursing Ann and feel a pulse on Nursing Ann of what atrial fibrillation feels like, okay? But here you're still going to count your QRS complexes for your rate. So 1, 2, 3, 4, 5, 6, 7, 8. So the monitor may say the heart rate is 80. It may say more than that. The heart rate may be all over the place, but you don't have a distinguishable P and you don't have a distinguishable T. And there's not a QRS complex for every P wave. So this is atrial fibrillation, just that little fine fibrillation that tells us that the atrium is just quivering as opposed to contracting. Couple things about this that you need to write down. If blood is not pumping out of those chambers, okay, then it's kind of sitting there and pooling, and if blood sits there and pools, then it starts to clot. Blood has to be moving, okay? If it was laying out on the table, it would be starting to clot. It's the same way in our body. So people that have atrial fibrillation have a are at much higher risk for blood clots. A lot of times they have to be on blood thinner. So this type of disorder, it is treatable. You can take medication for it. The main way that we fix it is an ablation, okay, and that most of the time can fix it, but they do have to be on blood thinners and medication. All right. The next one is premature ventricular contractions, okay? And this is where the ventricles contract too soon. So what you have here is you have some normal things going on, all right? So here's a P wave, a QRS complex, a T wave, but then just this abnormal QRS that doesn't have a T wave. You may have had some PVCs in your life before. They usually feel like if it feels like your heart has done a flip-flop, okay? That's sort of what a PVC feels like. Sometimes when the heart rate is slowing down after maybe, running for a few minutes or whatever, and the heart rate is slowing down, then the heart will throw what we call it throwing PVCs, and it kind of feels like the heart did a flip-flop. But these are this strange looking QRS complex that do not have a P wave and don't have a normal T wave. But in this one, you can see that they're having a PVC every other beat. This can also happen in dehydration. If someone is dehydrated, they can throw some PVCs as well. All right, ventricular tachycardia. These are the ones that look kind of scary, okay? This is where the ventricles, rather than the SA node is the electrical part of the electrical activity of the heart, or control center of the heart, are causing the beat, okay? So this is called sawteeth, okay? Now, I'm not there to know what you answer, but do you think your patient would be alive or dead with this? Actually, they can be very much alive and even sitting up there talking to you, and you can see this ventricular tachycardia, and it's kind of terrifying, okay? Because they can definitely go into a lethal heart rhythm if this continues on, okay? Something that you need to know about ventricular tachycardia is it is a shockable rhythm, all right? Remember back to our AED that you used in CPR, and the machine was telling us whether to shock or not, okay? We'll get to the rhythm in just a second that the defibrillator is monitoring for to know if you need to shock. This is a shockable rhythm, and I'll show you a video in a few minutes of how this can be treated with a lower voltage and to try to shock the heart back into a normal rhythm. But this is called sawteeth. They can be awake and conscious and sitting there talking to you, and all of a sudden you see this on the monitor. All right, ventricular fibrillation. This is where the ventricles are contracting faster than 350 beats per minute, and so the ventricles are just quivering, okay? This is a lethal heart rhythm, and your patient will not have a pulse, they will not be breathing, they will not be conscious. This is the heart rhythm that we can shock, okay? This is the one that the automatic external defibrillator, or AED, is looking for in order to try to shock it back into a normal rhythm, okay? So difference here, you can see, I know they look kind of the same, but VTAC, or ventricular tachycardia, that looks like sawteeth, or the teeth of a saw. And then this one, much more fine, that fibrillation, no rhyme or reason to it whatsoever. So if your patient goes into this, it would be, unconscious. Are you okay? Are you okay? No, they're not okay. Okay, they're not going to respond. No pulse, no anything. All right, so this, you would immediately start CPR and use the defibrillator as soon as it got there. All right, so here's, oh, forgot I had this slide. So there's the difference between ventricular tachycardia and ventricular fibrillation. Okay, one other that I don't have on here, but that you can draw anyway, is a flat line. Okay, you've all seen a flat line on TV or whatever where the person just goes into flat line. That is called asystole. Okay, Asystole. Sorry, I felt like I was in the spelling bee for a second. So asystole, Asystole. Okay, that is a flat line. No electrical activity is happening. This is important for the test. Asystole is not a shockable rhythm. Okay. Now I'm not saying that you won't see on TV them try to shock asystole. I'm not even telling you that you won't see it in clinical practice of someone or of a doctor saying, go ahead and shock them, as a last result. But it is not a shockable rhythm because there's no electrical activity happening in the heart. A lot of times, if they're in VFib and we shock them, then we could shock them into asystole. The goal of defibrillation is to shock the heart to stop it and get it to restart normally. But we could shock them into asystole and then it doesn't start back normally. That is when you continue your CPR, okay? We're going to continue CPR until a doctor or someone otherwise, or, if you're the one in charge one day, until you've worked on them an adequate amount of time, depending on what's going on with the patient. But hopefully with doing CPR and in a hospital setting using the different drugs that you use in a mega code situation, the heart would get back started, okay? So asystole, not a shockable rhythm. These two are shockable. This one for sure. This one you'd be shocking at a lower level, and we'll get to that in a minute. If I don't have it in the presentation, I'll tell you about it in a second. Okay, so we've talked about defibrillators before and life-threatening arrhythmias. So an AED it stops the heart and allows the heart to start a normal rhythm, and anyone can use one. You guys know that because it walks you through it. It tells you what to do. Okay, so let me go back because I must not have this in here. All right, so I'll probably have to put a video on Schoology for you guys to watch. So cardioversion, CARDIOVERSION, cardioversion is using a defibrillator at a lower voltage, okay, to try to shock the heart into a correct rhythm. They'll use this for AFib, that's atrial fibrillation. They'll use it for VTAC or ventricular fibrillation. And the video that I'll post on Schoology for you to watch is the patient is going to be in the operating room because they're not going to let you do it if they're awake, okay? I mean, this is an electric shock, and it does hurt and can, burn the skin, things like that. But a patient is not going to let you come toward them with those paddles or even the putting on the chest pads if they're awake. I have seen it done before on an awake patient, but that patient was in VTAC and they were literally probably about to go into ventricular fibrillation, and the doctor just very quickly just shocked them. But they screamed, it hurt. So for the most part, they almost all the time they just put them to sleep with they don't have to put a breathing tube down or anything like that. It takes all of about 5 seconds to do. But the patient is asleep for it. But that's called cardioversion, okay? All right, so just for the review, blank is a fast heartbeat, so that would be tachycardia. Blank is a slow heartbeat, that would be bradycardia. Blank is the atria beating more than 350 beats per minute. That is atrial fibrillation. And last but not least, a defibrillator stops the heart so that it can reset. All right, so after you have watched this video, what you need to do now is get your EKG paper out that I gave you on Tuesday. And if you were absent, the substitute has a piece of EKG paper, probably with your name on it, okay? But I may have forgotten someone that was absent. There is a whole packet of it on my desk that you guys can look for. But what you need to do is go back and you're going to want to trace, just lay your Chromebook down and trace each of these rhythms, okay? So starting with this one, normal sinus rhythm, and you want to label them, okay? So label them and trace them and label them. You should be able, it only has to take up a little bit of your paper, so you should be able to get all of them. Some people do it with the paper long ways, and they'll do like 1, 2, 3, 4, 5, 6, 7, 8, and then some people will just turn their paper vertical and put them all in line. It's totally up to you. This is just for you to study. There are strips on the test, and so this will be for you to look over for the test, okay? So you'll have 1, 2, 3, 4, 5, 6, 7, and asystole makes 8, okay? All right, you can email me or message me on Remind for any questions. Hope you guys have a great snow day tomorrow and a great weekend.